you must be Mateo's parents. My name is Jocelyn, and I'm gonna be the registered dietitian that's gonna be assisting you today. So I did just want to begin by thanking you for taking the time to meet with me. The whole treatment team and I truly appreciate it, as well as Mateo, and helping and aid in his recovery during this time. As I mentioned, I'm gonna be the registered dietitian that's gonna be assisting y'all. And I understand that this can be a very challenging time for you and your family, especially for Mateo, which is why I'm here to help you navigate through it and help you understand what's happening with Mateo, his current condition, his nutritional status, and how we're gonna move forward in order to aid in his recovery. As a dietitian, I'm not qualified to discuss his mental health diagnosis and condition, but I can help you understand his nutritional status and just how his nutritional health is being affected. Based on what's been mentioned and what I've seen on his chart, his signs and symptoms and his behavior, Mateo is showing signs of anorexia nervosa. More specifically, he is showing signs of the restrictive type of anorexia nervosa. In case you're not aware, anorexia nervosa is an eating disorder that's characterized by a lack of appetite. Usually, when a person has anorexia nervosa, it involves the restriction of either certain food groups or limiting food intake. It also comes with a fear of weight gain and a lack of appetite, and then also just a distorted perception of what they believe their body looks like. And what I mean by this is that Mateo might think that he's severely overweight when he might be in normal condition, or he might be, weigh a lot less than he thinks. And that's just an example. In Mateo's case, it was mentioned that he exercises very intensely, very aggressively, and that he also just keeps track of his weight and just like how his body circumference is. And because of this and his food restrictions, that's why I was able to identify it as anorexia nervosa. Again, more specifically, the restrictive type. To help you better understand this, I do want to let you know that anorexia nervosa is not a choice that Mateo is making. It is a health condition. And what I mean by this is that he's having an altered perception of food and his relationship with it. And in turn, this changes how his body controls his appetite, hence his lack of appetite. Based on Mateo's chart, his history that I was able to read, I suspect that his development of anorexia nervosa has to do with different contributors. So one of the contributors to developing anorexia nervosa is usually social pressure. And what I mean by this is that in Mateo's chart, I read that he was getting teased by his friends, for his plumpness and his appetite. And usually, when a person is getting teased, this does put them at an increased risk of developing an eating disorder. Additionally, I also read that y'all mentioned that Mateo is quite a perfectionist. And when a person is a perfectionist, that personality trait does also put them at an increased risk of developing an eating disorder. There is one more thing I read on his chart that helped me, kind of helped me guide in making and figuring out why he developed anorexia nervosa. And I do want to extend my condolences to y'all when I mentioned this. When Mateo went through the traumatic loss of his sister, because he was going through a traumatic event, it did put him at risk of developing an eating disorder. So just the traumatic loss of his sister, the teasing from his friends, and then also just the perfectionist personality. All of those can be contributors that caused his development of anorexia nervosa. I also, moving forward, I also do want to talk about like the nutritional concerns that I have for Mateo. As I was reading his chart, I was able to identify that Mateo has lost 45 pounds, and 45 pounds is a lot of weight for him to lose. It did drop him down in the BMI percentile. So right now he's at the second percentile BMI for his age, which is very concerning because it does put him at a state of malnutrition. Additionally, this can cause deficiencies in his body, like he can be lacking, nutrients that his body needs to function. And this can just be concerning because it does affect the way that he grows, such as his puberty, and then it can just have other effects on his long-term health as well. His chart also showed that Mateo has anemia with low glucose and high cholesterol. And then it also showed that he has low heart rate, also known as bradycardia, which is something that can be very dangerous and can affect his cardiovascular health in the long run. As I compared all of these nutritional concerns and just these concerns overall on Mateo's health, I went ahead and I compared it to what someone his age would look like, and he is a lot smaller and a lot shorter compared to what other peers his age would be. And this is due to the lack of food and nutrients that he hasn't been getting that are affecting his health. In his chart, I also noticed that he has muscle wasting and he has dry skin and he has lagunal hair. And all of these are also, consequences that have developed from him not receiving the nutrient that he should be receiving. While all of these medical conditions are concerning, I do want to make you aware that most of these medical conditions can be reversed as long as we get him into the proper treatment and just try to, try to act as fast as we can to making sure that we're aiding him in his recovery. However, I do want to make you aware that some of these treatments, some of these conditions, can potentially be irreversible, such as his muscle wasting. With his muscle wasting, it did affect his bone health. And depending on how long his body has gone without nutrients, it can potentially be irreversible, which is why we're trying to begin his treatment as soon as possible, just so that we can get him back to a healthy body weight and just stabilize his nutrition as well. So moving forward, I do want to discuss Mateo's treatment on how we're going to, how we're going to work to get him back to his healthy self and how to get him back to a stabilized nutritional status. In order to provide Mateo with the best care possible, he is going to need a comprehensive treatment team. This comprehensive treatment team is going to include myself as his dietitian, a medical professional, so his physician, that's going to be able to aid with any medical concerns that that Mateo might have, and just like how everything is affecting his body overall. And then the other professional that's going to be in his team is going to be a mental health professional that's going to be able to aid with his with the relationship that he has with food and helping him navigate his anorexia nervosa. Lastly, the other people that are going to be part of his treatment plan are going to be y'all too. So y'all are also going to be part of the treatment team, which is very important, especially when we're transitioning him to his at-home treatment, since y'all are going to be the ones that are going to be the closest with him and are going to be supporting him and guiding him throughout this. As a family, we want y'all to be as included as possible so that Mateo can feel the support that he needs during this time. As we first begin his treatment, I do want to recommend hospitalization for Mateo. The hospitalization will be inpatient treatment that will help us, stabilize his nutritional status and get him back to normal values without causing any damage. And the reason that I have to recommend hospitalization is because when a person loses 70% of their ideal body weight, it's better for us to treat them in the hospital. And Mateo has lost a little bit more than 70% of his ideal body weight through the hospitalization, we can work more closely with him. We can provide him any supplements that he might need. And we can also take this time to create meal plans that are going to help him slowly begin to eat more foods that he enjoys. That way we can start working on his relationship with food and making sure that he's eating as much as as much as his body needs in order to get fueled. During this time, the hospitalization will also help us and just preventing him from getting refeeding syndrome. And what refeeding syndrome is, refeeding syndrome can occur when a person starts to eat like numerous amounts of food when they've gone some time without eating. And by providing him the care in the hospital, we can make sure that we start his nutritional treatment by increasing food little by little, and then also introducing new foods little by little to where we can get him comfortable and transition into his new diet. So I do understand that all this information that I have shared was a lot, and it can be pretty overwhelming, but I do want to assure you that recovery for Mateo is possible. It's not going to be an easy road, and it's not going to happen overnight, but as long as we all work together, we're patient and we contribute our time, we'll be able to get him back to his healthy self, and that way we can continue working on his recovery. Working on his recovery isn't just about getting him on to his healthy self, although it's extremely important to get him to a healthy Mateo, getting him to a good way and being able to stabilize his nutritional status. The recovery also has to do with changing Mateo's perception with food and the relationship that he has with food as well. The whole team, myself, the mental health professional, y'all, and the physician, we're all gonna work together to make sure that Mateo's getting the best treatment possible and just helping him navigate throughout this time. Once again, I do want to thank y'all for taking the time to meet with me today. I truly appreciate y'all being here and supporting Mateo during this time. If there are any questions that y'all may have for me, I understand that I've provided y'all with a lot of different information. So if there's anything that y'all need me to emphasize, feel free to ask me any questions. I'll be here throughout the whole time to support y'all during this time and also to support Mateo. Thank you.